If someone does fall, what's one of the most serious consequences that can come from a fall?
Well, this is actually probably the most disturbing aspect of the fall statistics, because again, falls among the elderly is actually, and if you consider 2018 medicine, we're becoming more and more advanced. This is a problem that is getting worse. So we're seeing more falls, we're seeing a higher frequency of falls, we're seeing a higher burden on the U.S. healthcare system in regard to cost associated with falls. And this doesn't even have to do with the most important factor, which is the actual impact on the patient themselves. So when we take a look at, what are there, believe it or not, the CDC came right out and said that if you suffer a hip fracture after sustaining a fall, you have a 20% of dying within the first year or two.
Wow.
So it's something that this is a catastrophic issue. You could be golfing 18 holes, fall, break your hip, and then this is the statistic that we have, that comes in through here. In fact, believe it or not, currently 65 and older, you have a 1 in 3 chance of experiencing a fall every year. And that number comes to about 50% when you're about in the 80 population and older. So again, a very proactive, a very preventative approach is key. Wow. Just to obviously just mitigate this risk, even just the smallest amount.
Well, that's an interesting thought too for someone at home, that sometimes you hear stories of maybe a loved one fell, they don't report it to anyone because they're afraid that it's going to go and take them out, but you got to do something about it 'cause it could.
Right, and Ryan, not only in addition to that, a lot of times people do hide the fact that they fall, just to your point, because they don't want to relocate from their home or anything like that. But a prior fall is a serious indicator that another fall will occur again. Wow. So again, it doesn't necessarily mean that we need to change locations or go into a lot of the fears of nursing homes or anything like that. No. There's so many. The vast majority of interventions we can do are right there in the home. The goal for today's medicine is to age in place, age in the home, and that's ultimately what we can do from a preventative model. Unfortunately, if we have catastrophic injuries such as broken bones related to falls, those hands may be played for us, from the medical community. So.